So what is happening, everyone? This is my update, second week update of my ACL and meniscus surgery recovery. Pain level is almost zero, so it's no longer painful coming down from the bed or standing up or sitting down for too long. That pain which I used to have in the first week of all the blood rushing down, and it's no longer there. Right now I could sit for fairly long and stand for fairly long, and there is still some feeling of blood accumulation, but it's not it's not uncomfortable anymore, so that's good. At the start of the second week, I was very sore lying down. So if I lie down on my left side or my right side, within half an hour to 45 minutes, the muscles, and it's not the surgical area, it's the muscles, right? So my butt muscles, my thigh, my calves will feel very sore. And we quickly found out that it's because I've been lying down for too long and my blood circulation is really bad. So I did some cardio to resolve that. I will talk more about it during the routine part. And so right now that's gone too, so that's really good. I was being a little bit naughty. I removed my braces. So according to my surgeon, he wanted me to keep on my braces for most of the time. But I quickly found out that with my braces on, I couldn't sleep. And what the braces does is if you fall down, it protects you from any trauma, but mainly it locks you between the 0 degrees flexion and 90 degrees flexion. The mechanism is such that you cannot go below 90 degrees flexion. And so what the doctor says is you should keep it on even during your sleep, because you might have a dream and then just pull your leg and go beyond that 90 degrees. Well, yeah, I understand, but I took a chance, right? So I took it off during the start of the week because I really couldn't sleep well. And so far it's okay. I might wear like a knee brace, like a knee sleeve, a smaller one, just to prevent that from happening. Subconsciously or unconsciously bending beyond 90 degrees. I might do that, but we'll see. I did kick out a few times when I was sleeping, and I was awoken from that shock of that sensation, but so far it's okay. End of the second week, 14th day, I took out my stitches, and so that's great because that gives me the feeling of, hey, it's my normal knee again, my normal leg again, so I'll be able to take some photos and post it on for you guys to see how the wounds look like, stitched up and recovered. Okay, with regards to rehab objectives, did I achieve the objectives I set up for the second week? Not so much. So my knee flexion is about 80 degrees. I still can't get it down to 90. I'll post some videos so you can see. I'm okay. I do feel that okay. It's 80, right? So it's 10 degrees more. I do think by the third week I will get there. So I'm not too worried about it. Okay, so the soreness and pain, no more. Even that soreness when I'm lying down, thanks to daily activities, cardio activities, and just moving around, that's gone too. So comfort and circulation level really good. It's swelling and flexion swelling has improved greatly, and the flexion too. Mainly because I'm doing a lot of patella massages, right? I'll speak on them during the routine part, but it really helps with the swelling. Okay, so for routine, it's same as last week, but what I do is I added 30 upper body exercises. So let's talk about upper body exercises. So we still do 4 rounds a day of stuff, right? Every meal time and then the supper time, where I take my mats, do my knee drills, like your rehab drills, like your foot pumps, knee slides, tensing, contracting the quads muscles around the knee. But what I added is in the morning, I took out my resistance bands, go into a seated position, and start to do upper body exercises and core. So I'll do like seated banded presses, military presses, banded, maybe lats pull, some biceps, some triceps, right? And then some delts. And then for the core, I will go back to, lying down and do some V-ups, some sit-ups, okay, some twists. So nothing spectacular, nothing too complicated or difficult, basically just to maintain a good feeling of wellness and exercise. 3 sets of 3 different exercises for upper body, 3 sets of 3 for the core, and then also the back, right? So lie flat on my belly and then just raise the legs up. It really, every day I do it without fail in the morning, and it really starts my day and I feel strong, right? I've also added 30 minutes of electric therapy. So what I do is I bought a really fancy steam machine from Compax, right? So they have a muscle atrophy program, which I slap on like four different pads on my thighs, and just let the program do its work. So what it does is through the electrical stimulation, my muscles will then contract by itself involuntarily, and it's a 30 minutes program. I leave it to run by itself, do other things, and it really helped me engage my muscles again. So during the first week, however hard I try, I couldn't engage my thigh muscle. So only some parts of my quads were engaged, even though I was like, yeah, please, please contract, but it didn't do anything. But after a few days of this electric therapy, what I found is I could start to engage my muscles again, as I want to, and that's really good. So it does feel like my leg is getting stronger thanks to the electric therapy. I also massage my patella religiously twice a day, so once in the morning and once before I sleep. So we have a very nice cream from TCM, traditional Chinese medicine, a muscle rub from my folks. My folks are TCM practitioners, and I massage around the patella area, around the kneecap area, and then around the surrounding muscles, around the swollen parts of my knee. And I do really feel that it warms up the knee, gets a good circulation going in there, and the swell goes down, the knee feels good. I've heard that it helps reduce scar tissues, or at least prevents the bad scar tissues from forming, and which in turns helps you with your range of movement. So I do that religiously, and I think it really helps. What I'm doing less is I'm weaning off painkillers. I reduce from 8 painkillers a day, so 4 times of 2 painkillers, to 4 painkillers twice, 2 times. And right now I'm even taking just 2, right? So once when I wake up and once before I sleep, and I'm thinking, by the 3rd week I'll get rid of them completely. And also so that's good. So the 3rd week's objectives, I want to, by the end of 3rd week, go to 90 degrees flexion. I think I can get to 90 degrees for sure. What I want to go a little bit further. I want to get to 90 degrees with ease. So right now, it almost feels like every time I start to do knee flexes, I would feel tense and stiff, right, for the first few slides, and then slowly I will ease into it. And then towards the 80 degrees, I will feel very tight, like there's a strap that is pressed against my kneecap, preventing it from flexing beyond 80. I want to get to 90 and not have this feeling of tightness. Hopefully I can, right? Related to this, the second objective that I want to by the end of the week is once I can get to 90, I'll be able to go into some bent leg stretching positions. So I haven't been stretching every day, but those are straight leg stretches, right? So a lot to do with my glutes. Once I'm able to bend my legs, I want to, you know, bend and pull it into my body so I can stretch the outer part of my glutes, because I do feel that it's really tight. The ITB area, it's really tight, and that's because I haven't been able to stretch it efficiently. Now, the last thing that I want to do by the end of third week is I want to be able to do straight leg raises. So from being able to engage my quads and my the muscles around the kneecap area, it does feel like I'm able to concentrate more strength into my leg, and it doesn't feel as uncomfortable. Before that, it would feel like I'm pressing. By engaging the muscles around my kneecap, it did feel like I'm pressing down on my wounds, and it felt like, oh, if I press down some more, it's bad for the wounds. But this feeling is getting lesser. I think because the surgical wounds are healing well, and so I'm trying to. Even now, I can't lift my leg off the floor by itself. I need to reach down, use my hand, and lift it and manipulate it with my hand. I want to be able to lift my leg by itself off the floor, right? And straight leg raises. And if I can do straight leg raises, that means I could start to do some exercise that will train my quads again, my left quads again. It's really atrophied. And if I can at least do some exercises, straight leg exercises, at least that will slow down the atrophy and improve my leg strength. Right, so that's all I have to update for the second week. Now we're starting the third week, and keep you guys posted in a week's time.